Well, to talk more about the risk from the new variant Omicron, we're now joined on the program with Dr. Ravi Godse, MD Physician, Director of Discharge Planning, UPMC Shadyside, who's visiting currently in India. Dr. Abdul Samad Ansal, Director, Critical Care Services, Nanavati Super Speciality Hospital, Mumbai, and Dr. Sameer Gupta, Cardiologist, Metro Group of Hospitals, Delhi. Thank you so much, doctors, for joining us on the program this morning. Dr. Ravi Godse, first to you, looking at the situation around the world, especially in the US and in Europe, it's very, very worrying here in India. Now we have this, circular sent out to all the states. Karnataka already announcing measures on cancelling New Year celebrations.
I don't think it's worrying at all for India. There's not going to be a third wave. Omicron will turn out to be a big nothing, nonsense. These top 5 countries that you're showing right now, one country is missing from that. Do you know which one? South Africa. That's where it's all supposed to have begun, right? South Africa had 976 cases, then 8,114, maybe because of less reporting on Sunday. But the cases have now already crashed down to 15,000. The wave has come and gone. Omicron wave is not going to be like this. It is going to be like this. So the problem is, when it touches the peak, there could be a problem and it catch a lot of vulnerable people. South Africa resembles India more, lot of natural disease, and we have way more vaccination than them. We have 40% of the adults fully vaccinated, 2 doses. If India starts the boosters now and vaccinates the kids, anyway, India is okay. I stake my reputation on it. There's not going to be a Omicron third wave. You can take it to the bank.
All right, well, that's very interesting. I mean, given what we're seeing around the world and while, yes, in South Africa, I think it's already started waning. It's on the decline. The worry is that given our sheer numbers, whether we're going to see, a situation of health services being overwhelmed. Dr. Abdul Samad, your view of this and, what and the centers already sounded the alarm to the states, asking them to set up war rooms and, start monitoring clusters, especially right now.
Yeah, Ravi, morning. I completely agree on the one hand that we need to be very careful and we can be overcautious in our approach towards run-up of this so-called Omicron third wave. And there is a good sign that it may actually kind of plateau off early. But still, as you rightly said, the increasing numbers in a short span of time can overwhelm, strain healthcare systems. Especially, a fatigue has also set in. But there are better options now. People are more aware now and people are reporting early. Government has learned the lessons and we are kind of tracing contacts very aggressively. And I think cluster outbreaks need to be really looked very closely. And I think where we are lagging is we are not really sharing our genome sequencing results to really understand what is the spread pattern. And having more information will definitely make us more wiser. Extra caution is definitely advisable with a population of our size. But I think I agree with Dr. Godse that we may probably not see the same kind of impact like in the second wave. So let's keep our fingers crossed, move ahead.
No, absolutely. We're hoping we won't see that same impact. But again, we know that it doesn't show many symptoms. It's something that can move through the population. In fact, one of the interviews we just had was of a person who, only realized at the airport that he even had the virus and that it was Omicron and he felt absolutely nothing. Dr. Sameer Gupta, your view on the situation currently?
It's pretty interesting as to what is happening across the world. It's become, Omicron has definitely become the dominant strain in many parts of the world. If you look at the US, for example, right now 73% of all cases are Omicron and they're definitely seeing a spike. A similar situation has happened across the world. So, it's good to be proactive than reactive. We are taking, the government is and all the healthcare authorities are recognizing the potential impact of the strain. Now, we do also know that this virus has an immune escape mechanism. With 2 doses of the AstraZeneca vaccine that we have in India, there is the immunity significantly drops. So we really have to start planning a roadmap for the booster. We are also seeing other things that the monoclonal antibody is not very effective against this variant. Which is also something of concern because, we always thought we have that in our armamentarium as a fail-safe mechanism that, if somebody does get infected, we can use the monoclonal antibodies and significantly reduce the symptoms. As far as the third wave coming on, I'm a little cautious. I'm personally a little cautious to say that there will be no spike or something of that sort. Because what we saw in South Africa was, like Dr. Godse said, it just went up, it just shot up overnight. In 2 weeks, it's 73% of all cases are coming with Omicron. Yes, the vaccination does offer some benefit, but it is not as tremendous as we thought it is. The good news is that just this morning, the Walter Reed Medical Center has come out with a new vaccine, which is going to be against all the different COVID variants. And when that is actually rolled out, it will be a few months. So, there is some hope on the horizon, but it's not immediate horizon.
Right. We are waiting for more vaccines. Dr. Ravi Godse, you spoke about boosters, but right now there is no plan. The government not talking about boosters, even though there's been a clamor for that. And, reinfection with Omicron is the big worry, and immunity is waning. We started our program early this year, and for those vulnerable population, the elderly, they received it early in the year. So already their immunity must be very low.
Well, I think you all say all the plans to stop the virus. Testing, tracing, isolation. You should know what you can do and you cannot do. Don't try for the moon. It's impossible. We couldn't stop Delta. This is 6 times Delta. If you're going to trace and isolate a bus conductor in Delhi, the 3,000 people that he issued to, the whole nation will be in isolation and quarantine in 1 day. Economy will be in the tank. We cannot stop Omicron. We cannot stop it. It will turn out to be India's booster and Africa's vaccine on the cheap. We don't want more cases. How can we stop it? If it is 6 times Delta, how are you going to trace and isolate how many people? Hundreds. All those efforts need to be spent on finding out those who need monoclonal antibodies or the drug. So rather than increasing testing, President Biden wants to offer 500 million testing for 300 million Americans. What are you going to do? If your Titanic hits the iceberg, don't keep measuring the iceberg. Find a lifeboat. What are you going to achieve by doing more testing? If there are 50 people, if in Mahabharata, Kunti Mata is coughing and you are testing Pandavas because they are traveling, test Kunti Mata. If she tests positive, give her the monoclonal antibodies, move on. Stop doing asymptomatic testing. Report only hospitalization. Start the boosters for people who want it. Boosters will help you reduce the mild COVID and will help you spread it to the others. England has already given 43% of the boosters.
That we need, China, the WHO's, top official in Europe, even though the WHO has overall said that we want to, have vaccines available to more parts of the world rather than rich countries boosting their population. But the WHO head in Europe just said, boost. That's what he's saying. And clearly that has to be a way of protecting the population. Dr. Abdul Samad, so really, do you feel, all of us here, health experts and the news channels, etc., need to put more pressure on the government to at least announce some sort of a plan on the booster front?
I had previously also spoken about, I think I will first go by vaccine equity, and that's what is our first focus. And vulnerable population, we really need to identify where booster can be definitely initiated simultaneously. But rather than going on a booster way for all, I really don't know whether we have the wherewithal and the resources,
sure.
But vaccine equity comes as a priority. And I would still stick to that we need to ensure that vaccine equity is there first, and simultaneously the most vulnerable population should be considered for early booster initiation.
Because that does seem the fear that, those who are vulnerable, those who are immune compromised, healthcare workers like yourself, they're the ones who need to be protected right now. And hopefully this Omicron variant will remain a mild infection. Dr. Samir Gupta, your view?
Yeah, absolutely. For example, healthcare workers like myself, we were given our initial dose of the first 2 doses of the COVID vaccine in the second part of January. And we got our, at that time, the break was of 4 weeks. So we got a second shot by the middle of February. Now, it's been almost 9 months since that we got our vaccine. And we do know that the vaccine immunity that you get from COVID, it goes down over a period of time. In fact, with the Omicron variant, in lab studies, they have shown it's only 5.5% is the efficacy after 2 doses of the AstraZeneca vaccine. And however, if you do get a booster, your immunity goes back up to 71 or 75%, somewhere in that range. So I think it's about time we really start thinking of the booster, because once the hospitalizations go up, right? The hospitalizations will go up with Omicron. That's what we're seeing across the world. whether it's for the vaccinated or the unvaccinated. The healthcare workers are going to be the people who are going to be in the forefront, and the essential workers will be at the forefront. So we really need to start protecting these people, because if we get infected and now we are in quarantine, the healthcare staff is there's a shortfall of healthcare staff. So we really need to start thinking of
All right, I'll give the final word to Dr. Godse, who seems to have, a different view on this worry over Omicron. Yes, go ahead.
It's nothing. Only test symptomatic people. Boosters should be given in a heterologous prime boost. Means 2 doses of Covishield, give them Covaxin. 2 doses of Covaxin, give them Covishield. Bring mRNA. If you are running a TV show, so you already have a very good, kind, smart anchor, Gargi. You don't need another anchor. Get another technical person. So if you have taken 2 doses of Covishield, bring a vaccine that will boost your immunity. Start the boosters voluntarily. No third wave. India is fine. Nothing to worry about.
Well, that depends on whether we do get the boosters and get more vaccines in our kitty. Thank you so much, doctors, for joining us this morning on the program with your views on this threat from the Omicron variant.